Hi, my name is Chloe Hiles. I am a student PTA from Penn State Hazleton. Can I confirm your name and date of birth today?
Sinai 11/10/04.
And is it alright if we work together today?
Yes.
And do you know what day of the week it is?
It's Thursday.
Alright, so my patient is alert and oriented times 3. So today what we're going to do is, I understand that you've been having some issues with your shoulder, mainly with this motion right here, and like you're just feeling like general weakness. So what we're expecting to do with this treatment is, I'm just going to do some measurements, we're going to do some stretching, I'm going to have you do some exercises, and hopefully we're going to get you up to that level of function that you were at before. Basically, we're going to try to decrease your pain with strengthening these muscles. So I just want to know, what kind of issues have you been having since having this injury?
I can't like brush my hair or wash my hair.
Oh, okay. So would you like to get back to those things? And what goals do you have for treatment today?
To get back to brushing my hair and washing it.
Okay. So, what is your pain scale today on a scale of 0 being no pain, 10 being the worst pain you've ever experienced?
3.
All right. And I'm just going to ask you a couple questions here. Do you have any sort of pain with movement?
No.
Do you have acute inflammation?
No.
And do you have severe cardiopulmonary disease?
No.
All right. So where are you feeling your pain today?
Right here.
All right, so I'm just going to feel that area a little bit. Do you feel pain kind of anywhere out here in this area?
No.
Do you feel it more inside?
A little bit. Not so much like that way.
Is it just like kind of right in the middle?
Yes.
All right, and I'm going to do a skin inspection on her thoracic outlet. Obviously, I'm not going to do like the full thing. I'm just going to do a little. Her skin's intact. It's all good. Her scar was intact. Everything is good. So now I'm just going to have you lay down on, not yet actually, I'm going to measure your right arm, so I'm just going to move this chair over here and have you sit back down. So what I'm going to have you do is I'm going to have you reach out like this, punch. Good. So I'm going to have you punch all the way out and go all the way in, and you're going to go like halfway through that motion. So what I'm going to do is I'm going to push back against your arm. You're going to apply counter pressure. Don't try to overpower me, and you're just going to count to 3, okay? All right. And go.
1, 2, 3.
All right. And Cheyenne's MMT test is a 5, but for my patient for this case scenario, it would be a 3+. A 3+ is a patient who can go against gravity. However, they have they can only do it against minimal resistance. All right. So I just I measured your serratus anterior punch kind of thing. And I see that we can have some room to improve, but don't worry, we'll fix that. So what I'm going to have you do now is I'm going to have you lay on this table on your stomach, if you could tolerate that, if that's all right. All right. And I'm going to have you bring your right arm up. Thumb up, like this. All right, go all the way down. Actually, I'm gonna have you come a little bit more. All right, that's good. All right, bring your arm up, down, and then halfway through the motion. And we're gonna do the same thing we did before. I'm gonna have you count to 3. Just meet me at my resistance, all right? Ready? Go.
1, 2, 3.
All right, good. So she is a 3+. Well, Cheyenne herself is a 5, but for this scenario, she's a 3+, which we've stated already means that they can go against gravity with minimal resistance. All right, so I'm gonna have you roll. Actually, no, hold on, stay right there. I lied. Just kidding. So what I'm gonna have you do is you're going to do the exact same motion. I'm gonna have you bring your arm up, but we're gonna do it with a weight. We're going to do 3 sets of 8.
And now I'm going to give you the weight, so go ahead. All right, and now we're going to do that for...
Are you feeling any pain?
No.
3 sets.
All right, we're gonna say that she did her 8 sets of 3. How are you feeling?
All right, you can go ahead and sit.
All right, so when you're at home, do you have a pound weight or something similar to this kind of weight where you can keep your thumb up? All right, so when you're at home, I'm just gonna have you do the exact same thing. If you're feeling any sort of like intense, like pinching, pain, aching, soreness, that's expected. Like that's okay. But if you're feeling intense pain while you're doing the exercise or afterwards, please stop. Do not keep doing it, and we will reassess when you come back in. And that goes for everything that we're going to do today. Okay? All right. Now I'm gonna have you lay back on your back, and you're just gonna come over here. So I'm gonna be measuring Cheyenne's external rotation. So what I'm gonna do here is I'm just gonna see how much range you're getting. We're gonna try to fix this so that you can start brushing your hair again. I'm gonna have you just, if you can move your hair to the other side, Thank you. And I'm just gonna put this underneath, this towel underneath, so I can keep your shoulder at neutral. All right. And I'm gonna be moving your arm passively. So you're just gonna relax and you're just gonna let me do all of the movement. If you're in any sort of intense pain, please let me know. All right. So Cheyenne's external rotation is within normal limits. So she's kind of above normal limits. She's at like 100. So 95. We're gonna measure one more time. Actually, we're gonna do it one more time. So we are starting at 0, and then we will be bringing her all the way.
I'm just gonna put the towel under here for alignment.
She's actually at 95, so that's a little bit above normal limits. How are you feeling, Cheyenne? Are you okay?
Yes, I'm okay.
Okay, so for this scenario, she would be at 45. So what we're going to do is, I'm going to show you a stretch, but before we do that, I'm going to have you do one more exercise laying down. All right? Do you remember that punching motion that we did earlier?
Yes.
All right, so I'm going to have you show me that motion one more time. And now we're going to do it with a pound weight. If this is too heavy, please let me know. And I'm going to have you do this 3 sets of 30. 3 sets of 10. All right, how's that feel?
Good.
All right, so in total you'll be doing it 30 times, not 30 every single set. So we're gonna say that you did 3 sets of 10. How do you feel?
Good.
Any sort of intense pain, aching, itching, burning? No. So now that you did that exercise, I'm going to show you sort of a stretch that we're going to do at home. So I'm going to have you stand up here for me. You will also be doing that at home as well if you have, because you told me before you have a weight, so you should be able to do that at home.
Yes.
All right, so we're going to come over here. And since you've been having problems with your external rotators, you're just going to put your arm on a doorway like this and just walk forward until you feel a stretch.
Okay.
Just beyond resistance, don't go anywhere that's too painful, and you're going to hold it for 30 seconds. You're going to do it 3 times, okay? So I'll have you demonstrate that for me. And then you're going to hold that for 30 seconds. All right, you held it for 30 seconds. How do you feel?
Good.
All right, you'll be doing that at home as well. So now I'm going to show you. All right, so that's what you'll be doing when you're at home. You'll be doing the tricep or the exercise like this, the punching one laying down, and then you'll be doing the stretch. You'll be doing for the strengthening exercise. You'll be doing 3 sets of 10. For the stretching, you will be doing 3 sets, holding for 30 seconds. You will be doing it 2 times a day, every other day. And like I said before, if you're feeling any sort of intense pain, please stop. We'll be evaluated when you come back to therapy. I'll print out your exercises for you so that you could do them at home. And I'm just going to palpate here, see where your pain is. Okay. Is it still in the same area? Okay, good. On a scale of 0 to 10, 0 being no pain, 10 being the most intense pain that you've ever felt, did your pain increase or decrease today from the...
It's a 1 now.
Oh, okay, good. So I'm happy that your pain decreased. And that is all that I have for you today. Do you have any questions for me? All right, thank you. I inspected her skin the last time. Her skin is still intact. Thank you for letting me work with you today.